My name is Elli. I am the founder and CEO of Mexico Bariatric Center, Mexico Cosmetic Center, Cellular Stem Cell Institute, and Hospital Azar. And I have with me today Dr. Raquel from Tijuana joining us. She's our specialist for stem cell residing in Hospital Azar in Tijuana. This is the first time that we're doing a webinar like this, and we are basically trying to educate you about the potential of advanced regenerative medicine with stem cell exosomes and see what is it that we can offer in Mexico, which is very unique, and our center, Hospital Azar in Tijuana, what we can do for you. So that's the whole purpose of this webinar. I hope that will be useful for you and you can learn from it and take advantage for your well-being. To get a consultation from us, all you have to do is to go to cellularstemcell.com/health-questionnaire, which actually, if you go to cellularstemcell.com, you can basically find the health questionnaire and submit it. Once you submit your health questionnaire, we would review it with our surgeon liaison and Dr. Raquel, and coordinators can set up a free consultation. At this time is at no charge, a 15-minute consultation with Dr. Raquel. So you can go over your health questionnaire and find out what solution is best for you, whatever you are looking for to get from stem cell, from just anti-aging well-being to joint problems, pain management, and anything from nerve damage to organ problems like kidney, to diseases like MS, Parkinson's disease, diabetes type 1. And basically, you can get a free consultation at this point from us by just going to cellularstemcell.com and submit a health question. And at this point, Heather is our dedicated coordinator in the US that would handle all the health questionnaire, connect you with Jen, which is our surgeon liaison, and Dr. Raquel. The topics we're going to cover today is basically, I kind of introduce myself. I go a little bit more about me. We will introduce Dr. Raquel, and we will have a little overview of what stem cells are and what they can do for you. After that, Dr. Raquel would go in depth about limits of traditional medicine. What is the stem cell therapy? What are the applications and benefits? We would also talk about exosomes therapy, what it is and what application and benefit it has. And then we talk about why Mexico. Why Mexico is a leader in the world for stem cell and what it can do for you. And we would talk about our hospital, the hotel accommodation, all the packages that we offer, and touch on financing if you need some. And if you, we will talk about MTI, which is another unique feature that we offer to our patients, which is medical tourism insurance, about aftercare support, and all the other procedures that we offer in Hospital Azar. I've been in the medical tourism industry since 2007, and I started in Mexico Bariatric Center, which is leader in the weight loss surgery in the world, I would say. In 2012, I started Mexico Cosmetic Center, which is one of the most popular brands for plastics and post-bariatric weight loss surgery, plastic surgery. And we're doing orthopedic now. We're doing all these other services, including stem cell. I started Hospital Azar in 2021, and I finished it in 24. Since then, we've been offering diverse healthcare, global healthcare to all patients across the world. We will talk about Hospital Azar in a bit. I'm just giving you some glimpse. Basically, Hospital Azar has given us the bandwidth to bring surgeons, super surgeons, qualified surgeons to do all type of surgeries that is related to weight loss surgery. Like I mentioned, Mexico Cosmetic Center is top brand for post-bariatric patients that they can do mummy makeover, facelift, all that. We do gynecology. We do very difficult procedures like endometriosis, of course, hysterectomy. We do neurosurgery and orthopedic. We can do anything from a repair of a joint to replacement of hip, knee. And one of our most innovative solutions is the stem cell, which Dr. Raquel is going to go in depth today. Just to give you a brief introduction, is like, what is a stem cell? Stem cell basically is part of our body that, let's say, if I get a cut on my skin, the stem cell is going to come and repair the skin, repair the blood vessels to renew that area, so it will not have minimal scarring, and it will repair that injury. That's what stem cells do. Now, let's say, now what's the application of stem cell for well-being and diseases and things like that, right? Preventive pain management. Regenerative medicine can help, let's say, a soccer player that got injury and blows out his ACL. It can help that soccer player. If a 45-year-old guy has a knee arthritis, stage 2 or 3, the stem cell can go in there and regrow the meniscus and help with arthritis. Let's say a grandfather has Parkinson's disease. The regenerative medicine can help with that. So these are the applications of stem cell. Now, FDA has not approved the stem cell in US. And that's why Mexico is #1 in the world, because we are using high quality stem cells from donors, from young donors, to do all this that I mentioned. So, and there is a misconception because they say, what is, the US also advertises for stem cell. Yeah, you can get the stem cell from your own bone marrow or fat. And sometimes, for joint, for example, they call them PRP, right? But those are the stem cells that is coming from your own body. The problem is they are not as concentrated as it would be when it comes from a young donor. And also, as we age, the quality of the stem cell become less and less fragile. So it is a viable option, but it's not what stem cells can do for you when it comes to Mexico, because we have high concentration of stem cell, which you cannot get in the US from the young donors. And we've been doing this for 15 years. The quality of stem cells are also very important, let's say if they apply 100 million stem cells for you, and the stem cells are not high quality, they're tired, they're exhausted, or this is what they call them, they are not going to be effective. So you need to pay attention to the lab that you get the stem cell from, and the way it's applied, and the way it's handled. So these are all the details that you may want to pay attention. So to be effective, you need high dosages of stem cell, and you need to have high quality stem cells. Now, Dr. Raquel has been with us for years. She's one of our valuable assets down in Mexico, and she's working right now with our regenerative medicine. And she's experienced in so many different ways: aesthetic medicine, regenerative medicine, and she's going to take over from here and talk about all the limits of traditional medicine and so on and so forth. Dr. Raquel, I'm going to let you take over, and I will be on mute.
Thank you so much for being here in our webinar. I am Dr. Raquel Martin. I am a general physician, I'm an esthetician, and I am also a regenerative physician. I've been in Hospital Azar for about 10 years. So right now, what we're going to be talking about is stem cells and the approach that we're doing here in Hospital Azar with mesenchymal cells. First of all, when we talk about the limits of traditional medicine, I want to have the understanding that we're not mad at traditional medicine and we don't want to take anything away from it because it's there for a reason, obviously. However, there's certain problems with certain illnesses or patients that sometimes traditional medicine can make you feel worse in a way. So because you have to see if you want to use steroid injections, if you want to use some medications may give you some after effects or something like that. So that's why right now with regenerative medicine, we're helping our patients regenerate and control inflammation, control pain, and try to not use as many prescription medication so that you can move forward with your life and have a better outcome, right? So some of the current options that you have with traditional medicine is like steroid injections, which are very temporary. It only fixes certain things, and it's only for a temporary amount of time because these have a lot of side effects. Also, prescription pills, painkillers, stuff like that. They can irritate your stomach. They process through your kidneys. They can give you kidney malfunction, etc. Joint repair and replacement with surgery. Sometimes surgery is very necessary. However, a lot of patients can be a lot older, or if you're really overweight, etc., and your recovery is going to be a lot longer, and it takes a lot more time. Next one, please. Okay, so now what are stem cells? Stem cells are a specialized cell that is capable of dividing and renewing itself. We call it also master cells. They make more copies of itself. So they help you heal a lot easier, right? And they're normal repair cells that we have in our bodies to help the tissues and our organs. Okay, how do they work? They have the unique ability to develop into specialized cells with specific functions. So it depends on what kind of cell we want to work with. So some stem cells can create brain cells, muscle cells, blood cells, cartilage, that kind of stuff. Next one, please. Now we're going to be talking about mesenchymal cells, which is what we're doing and treating our patients here in Hospital Azar. Mesenchymal cells are an adult form of stem cell. That's very important to understand because some patients think that we're using embryonic cells. We do not use those. These are not FDA approved. They're not COFEPRIS approved. Embryonic cells are cells that are banned in Mexico. So legally, we do not use these. Okay. And mesenchymal cells are adult donor cells that we use that possess the unique ability to differentiate into a variety of other cells, including bone, cartilage, muscle, and fat cells, other cells like skin, and anything that we need to repair. Okay, what do? They do active repair. So they releases powerful molecules that signal our body to heal itself. So it's more of a messenger. It does not. We have that's something that's very important to understand. Mesenchymal cells do not create other organs. They do not do that. They help your own body regenerate itself, mediating inflammation, reducing and signalizing your body to do better work and to heal itself a lot easier, to regulate your immune system. So that's why we use it a lot on patients who have autoimmune diseases because it regulates their immune system, it regulates their inflammation. So that helps them a lot with flare-ups and with to control their illnesses, and also supporting growth on blood vessels and healthy tissue. Okay, and it has enhanced potency. So we culture it in our lab where we make the cells proliferate, and that's why we can get higher concentrations of these cells, like 35 million, 60 million, 100 million. So it depends on the dose that we want to use. Our primary sources of mesenchymal cells, we get these from different types of tissues. First and foremost, it's bone marrow. Adipose tissue is very used here in Mexico. It's a lot easier to get. Umbilical cord, we also get it from dental pulp. And dental pulp is used a lot on neurodegenerative disease. Wharton jelly, which is from the placenta, and yeah, and adipose tissue. With bone marrow, is the gold standard for orthopedic repair with high concentrations. And our adipose tissue is fat derivative mesenchymal cells that offer massive yield and are easily acceptable via minimally invasive procedures. Umbilical cord, the Wharton jelly provides younger cells that with superior proliferative capacity and lower immunogenicity. Okay, so our our 8 applications. These are the top cell applications that we use on our patients with stem cell therapy. First and foremost, joint pain and management. Most patients have joint issues. If you are an athlete, if you are an elderly person, or just somebody that has joint issues, arthritis, this can reduce inflammation. It can help with pain relief, improve mobility, and treating sport injuries, etc. Hair growth, it is shown that stem cells can help with hair restoration and follicle stimulation so that you can regrow your hair. It can be with men and women, okay? Neurological health, we've been using it for patients with Parkinson's disease. We can use it for patients who have had a stroke and to help with their side effects and to reduce inflammation. We can use it also on patients who have autism or ADHD to help with their cognitive function. Orthopedic disease disorders, whether it's bone or cartilage repair, to treat neurodegenerative diseases, and also autoimmune diseases like fibromyalgia, lupus, Sjogren, all of those MS. Anti-aging and skin treatment, we can use it to reduce fine lines and wrinkles. We can use it to help with scarring and just stimulate collagen. Metabolic and health and heart health, very important. This is something that we've been doing for many years. We can help our patients to reduce their cardiovascular risks, help with diabetes, regulate their blood sugar a little bit better, um, also with cholesterol, etc. Chelation, when we talk about chelation, it's just basically a detox. We can help reduce heavy metal and help with our blood vessels and our circulation. Post-op recovery, this is something that is our main focus right now with our patients, since we do have a lot of patients who come to have either plastic surgery or come to do bariatric surgery. So stem cell therapy can help you to reduce um, inflammation. It can help reduce pain and overall help with your healing process so that it can be a lot faster. Okay, with our stem cell applications, there's many ways that we can apply stem cells. The three most common is local injections. When we talk about local injections, we're talking about um, joint injections, doing it directly to the joint, either it's your shoulder, your knee, your anywhere that you may need it. Or we can also do it through your spine. We call it intrathecal, and that is going to be very specific patients. So it's going to be very personalized. Mm, we use it usually for patients who have arthritis, sport injuries, nerve damage. When we talk about nerve damage, we can also do it subcutaneously. It doesn't have to be just on the joints. Uh, Patients who have neuropathy and other conditions that's localized, we can apply them subcutaneously through their skin so that it can follow the nerve damage and help and make it reach there the closer it is. Systemic IV application. So IV application is the most common use of stem cells because this can help us go all the way throughout your system to help inflammation. So it reduces inflammation and treats systemic diseases. It gets distributed throughout the whole bloodstream. And the most common uses, we use it for autoimmune diseases, chronic fatigue, heart health, Parkinson's disease, we use it for diabetes. We use it for just in general for wellness and also for our patients who want to have an easier recovery time with post-op surgery. It's IV treatment. We also do hybrid applications. When we talk about hybrid applications, we're talking about that we can do both, either IV applications and local or spinal applications. This is the preferred type of treatment, especially for patients who do have like joint pain or they have issues in their spine or anything like that that's localized. The preferred way to treat patients is with both. Do it IV and local. Another thing that we're doing is adding also exosomes, but we're going to talk about that a little bit in a bit. Our main stem cell packages, we can use any amount of stem cells that we want. The maximum is 100 to 150 million per session. However, these are the few packages that we have. Rejuvex, which comes with 35 million stem cells, and Regenex that comes with 60 million stem cells, and Renovax that comes with 100 million stem cells. The Rejuvex is a standard wellness and anti-aging package, therapeutic baseline, and maintenance and viability. Regenex is a higher potency and recovery. It has a higher dose. We can use it for chronic pain, post-op recovery, and anti-aging as well. And Renovax is something that has the maximum dose, and we use it for total body transformation and for patients who really need higher doses for a better efficiency. Okay, what are the benefits of our innovative stellar stem cell? What we call stellar stem cell, we talk about for patients to help them faster healing, support joint and spine pain, increase wellness, and treat diseases like diabetes, kidney disease, Parkinson's, etc. What can our stellar stem cells benefit with our patients who have come for bariatric and cosmetic surgery? First of all, is control inflammation, recover a lot faster, tissue regeneration. That's a big thing to help you regenerate your tissue, and the scarring is going to be a lot not so bad, a lot better. Improve skin texture, scar reduction, extra hydration, and strengthen internal healing. And if you have other underlying conditions, also going to help with your other illnesses if you have any. Okay, now we're going to talk about exosomes. What are exosomes? Exosomes are a nanos. Mm, They're little vesicles that are extracellular and they're really, really small. So they're nanoscale from 30 to 150 nanometers. This means that they can go anywhere. So we use them a lot for neurodegenerative diseases because they can pass through the hematoencephalic barrier. Okay. They represent a cell-free revolutionary alternative to traditional stem cells. So they can be used by themselves or together with stem cells, preferably depending on what patient, but preferably it to be combined and use them together because what they do is these are like ambulances. This is the way I would describe them. And they help make the cells work a lot faster and they signalize your cells to go to certain places that you need for inflammation a lot faster. We can use the exosomes for hair loss. It combats thinning and it also signalizes for stimulation growth. Kidney disease to help healing and reduce the inflammation in our kidneys. Autoimmune diseases, since they are higher potency with anti-inflammation than stem cells, these are a lot. We use them a lot on autoimmune diseases to reduce inflammation. And we can use them also for aesthetics, like microneedling to reduce scarring, improve elasticity and hydration in our skin. So what is the comfort? We're going to compare a little bit the difference between mesenchymal cells and exosomes. First of all, the mesenchymal cells, they're living and they're not replacing cells, but they come from cells. And this and exosomes are non-living and they're vesicles. Okay, we have them in our cells, but they're not cells. Okay, delivery, they're localized mostly, and the exosomes can be much more systemic because they can, like I said, they can go through barriers, right? Immune risk with mesenchymal cells, the risk of having like an allergy or something to them is very low because they're very specific and then it's very low risk. And with exosome, it's basically none to zero because they're non-immunogenic because they're not cells. Okay. Storage, they have to be frozen, otherwise they'll die. So preserving the mesenchymal cells is very complex and important. And with exosomes, you can have them refrigerated, so it's a little bit easier. And mechanism, the mesenchymal cells are mostly for building and signalizing and to help repair. And exosomes are mainly for signalizing. So what they do is they help work better. Okay. So different uses that we can do for aesthetics and skin are stem cell therapy. It stimulates deep collagen and production with anti-aging. Exosome therapy can enhance with microneedling, reducing scarring, and revitalizing thinning of hair. And neurologically in our brain, the stem cells are going to promote neuroprotection and signalize with stroke recovery, and we can use it for Parkinson's as well. With exosomes, we can use them through a nebulizer, and they can help with inflammation. We can use them for the same type of diseases. We can use them for also ADHD and autism. And with orthopedics, basically we can use both to relieve pain and reduce inflammation. What are our therapeutic mechanisms with exosomes? So first of all, it's immunological. They help modulate inflammation to help with reducing chronic inflammation and providing cytokine storms. Um, Angiogenesis. When we talk about angiogenesis, we're talking about stimulating the formation of new blood cells and new blood vessels to restore oxygen to the damaged tissue. And anti-apoptosis. Anti-apoptosis is directly inhibiting, like stopping the progress of cellular death so they can last longer. Our clinical impact metrics, as you can see, it's a very high percentage of efficiency. So our exosomes with inflammatory reduction can go up to 85%, tissue repair 70%, cellular viability up to almost 100%, 92%, and our patient recovery rate is about 80%. As you can see, they're good numbers. Okay, this is a new topic. It's called natural killer cancer cells. It's a new treatment that we are looking into and creating our protocols for our patients to help with cancer treatment. Because something to take into account, if you want stem cell therapy, you cannot have cancer. If you have cancer or have had recently cancer, you are not a candidate. So for patients who have stage 4, stage 3, it doesn't matter what stage of cancer you have, this is another type of treatment that can help to reduce the metastases or just give you a longer period of time, and also kind of keep you in remission. Natural killer cells are specialized white blood cells that are constantly in patrol in our body, identifying and destroying cancer cells. Um, the typical cancers that can be treated, usually we use it for leukemia, lymphoma, multiple myeloma, and solid tumor cells. When we talk about solid tumor cells, we're talking about breast cancer, ovarian, pancreatic cancer, glioblastoma, something that's more solid. Every treatment with natural killer cells is very personalized because every patient is different. It's a new protocols that we are doing. So just stay tuned for that because it's going to be very different to our treatments to stem cell therapy. But it's something that we are trying to help our patients who also have cancer. How do I qualify? First of all, you have to send the questionnaire, and depending on the questionnaire is the things that I'm going to ask from you or want more information. We do need to do a cancer screening. If you are 50 years and up, I'm going to ask for a cancer screening. If you have family history of cancer, it's really important that you do put it in the questionnaire so that we can do the cancer screening when you arrive to the hospital, just to make sure that you do not have it, yeah, or any type of cancer. We do a screening for the most common types of cancer in the United States and in Mexico. And if you have had cancer, you must be cancer free at least 6 years in remission. Okay. We do blood work. So I do need to see your blood work. Avoid smoking, avoid alcohol before coming for treatment. And also we need to avoid anti-inflammatory medication like ibuprofen and stuff like that a couple of days before.
Well, thank you so much for explaining all the scientific part of this. I'm going to talk about the package. At the same time, I'm going to release a Zoom poll. Please, if you don't mind, fill these few questions for us so we can get feedback of if this presentation is useful for you and how we can help you with stem cell moving forward. Basically, our packages include the first day arrival when you come and we do the pre-screen test, like Dr. Raquel mentioned. The package also included one night hotel stay, which we use Hyatt, and the next day treatment. Now, if you do hybrid, it would be probably the first day IV, and then the next day would be the local injection in the joint or spine. And we could do, you can add extra hotel nights. We can do hyperbaric chamber after the third day. So we can combine with this with much more services that can be used for well-being. We talked about the questionnaire. Dr. Raquel mentioned, I mentioned. You go to cellularstemcell.com, CSCI, and fill out the questionnaire. We review that. The coordinator contact you. You get a free consultation for 15 minutes with Dr. Raquel, so you can get the best advice of how to go about this. And once you put the deposit, we would schedule you and you go down there. Like I said, that's a package. You can add anything from transportation to extra hotel night to hyperbaric chamber. And as far as the medications, to stop or start, if you're on GLP-2 or 3 or 1, 2 weeks before, stop that, please. No blood thinner, no smoking, stop NSAID 7 days. And basically, we give you instructions if you're taking a medication on a permanent basis. Again, you can add, if you're coming from outside, you can add transportation to this package. We want you to arrive before noon and leave after 2 p.m. The night of the arrival, you stay in Hyatt. That's included in the package. And you get a one-on-one consultation, of course. We talked about hyperbaric chamber. We offer hyperbaric chamber at 2 atmospheric pressure or more, which is useful. Anything below 2 is not really going to do anything for you. And that could be combined with the package to get better results. Like Dr. Raquel mentioned, the preferred method of stem cells is IV. And if you need any treatment in your joints or spine or nerve, then or Parkinson disease, things like that, to do a IV first, and the next day do injection. We are a medical tourism company, so we have all the infrastructure from transportation to hotel to medical tourism insurance. So this is a preferred way of going to outside of your country, overseas, to get across the border to get treatment, because we have all the infrastructure. And basically, we provide peace of mind, which means you get quality services, peace of mind at the same time. Now, I mentioned something about Mexico, right? So stem cell is not FDA approved in US, but it is COFEPRIS approved in Mexico. Um, the lab has been over probably 18 years doing this. We have the best stem cells available and high concentrations, which is 100 million, and in which you cannot get in US, of course. And you need high concentration of stem cell and quality stem cells to be able to um, address all the problems that we mentioned. Um, of course, the hospital is full service hospital accredited. We are in the best areas of Tijuana, next to Hyatt. We offer medical tourism insurance, and we have access to a network of doctors, surgeons, scientists that makes us to be preferred choice. Dr. Raquel, for example, they're very specialized exactly what area you need help with. Um, a little bit about Hospital Azar. Like I said, this was a project I started in 21 and finished in 24. It has 4 ORs and we have 40 rooms. We do different types of procedure, all related to weight loss surgery, including stem cell. And we've been very successful. Now, one thing I want to mention is because we are a full service hospital, for example, let's say if we want to do a spinal injection, we get the most experienced anesthesiologist to do that in the clean room OR, which is a standard grade operating room, not just some clean room in a clinic or an office that they call it so-called clean room. So you're getting the best services for whatever the stem cell you need. Like I mentioned, MBC is in the forefront of bariatric surgery. We offer a wide range of laparoscopic, endoscopic, from sleeve to bipartition to duodenal switches to bypass, mini bypass. Our plastic cosmetics center is state of the art. With super surgeons can do mummy makeover, fleur de lis, circular, facelift, breast lift, arm lift, all we can do. We can do hybrid procedures, like we can do hysterectomy and gastric sleeve. So this is the amount of expertise we have in the hospital. I mentioned about arthroscopic and hip replacement, knee replacement. And we do have a spa with massage, Botox, exosomes, treatment. Exosomes is really popular right now for hair loss. Microneedling, Dr. Raquel is expert on that. And we have all sorts of supports for you, including surgeon lives, Dr. Raquel Go Live. We do webinars for plastics, bariatrics, uh, different disciplines. That stem cell is our first webinar. And we have a network of our past patients that work with us day to day to support you. We have coordinators in New Zealand, Canada, US, all across the world. We do use Hyatt for our hotel. Is one of the best hotels in Tijuana. And I mentioned at the beginning about MTI, which is medical tourism insurance. They're very affordable. You get coverage for complications, any sort of travel accident, things like that, you're covered. Now, there was a question about financing. We offer one of the best financings out, which is Klarna and Afterpay. So if you need financing, just reach out to your coordinator. For stem cell and exosomes, Dr. Heather is our in-house coordinator that deals with the patients day to day. She's the one that supports you. She's the one in contact with you. She's the one puts you in contact with Dr. Raquel, make an appointment for you, and have the free consultation. Again, if you haven't done the questionnaire, you find it on cellularstemcell.com, and you can submit that. We'll be in touch with you. And if you need a free consultation, 15-minute interval appointment with Dr. Raquel, which is huge. At this time, there is no charge for that. You can take advantage of it. We are going to go open up to answer the questions, Dr. Raquel.
Mhm.
So we're gonna start answering questions that they ask. There are some in
Yes.
chat. Let me see. So they're supposed to put it in Q&A, but they put it in chat also. Now, we would be publishing this webinar online maybe by Wednesday. So just reach out to Heather and she will send you the link. It probably will be on YouTube, but anyhow, you can get the recording of this presentation online. I did mention about finances. So again, reach out to Heather. We send you a link for the amount of loan you're looking. It's very simple process. You just fill out your information. In 15 minutes, you get approval, but sometimes, you may not get all the way what you need, but you can pay and then get more and more and get exactly what you need at the end. There is a question says that, and then we did mention about, Kathy is asking about the stellar stem cell. Stellar stem cell we've been providing to our preoperatively for better post-operative recovery. We talked about inflammation, especially for bariatric and plastics, right? Plastic is going to help you with skin, recovery, better scarring, less inflammation. And in general, it's going to help all your organs and your body parts anyway. So yes, a stellar stem cell is a solution you're looking for. Can stem cell help with muscle spasm, cervical dystonia, and breathing issues?
Okay. They can. First of all, we need to know the underlying condition of why you're having those muscle spasms and the dystonia with your cervicals. Breathing issues, that also depends on what you have, but yes, we can use them because stem cells can help you mostly with your muscles, and the exosomes we can help with breathing issues. Once This is something very important to understand also. This is why we recommend patients to have more than one session. The first session, most of the stem cells are going to be pulled by your lungs. Why? Because we are all inflamed. We have a lot of inflammation. And if you have breathing issues, a lot of those stem cells are going to go to your lungs. So that's really important. And that's why we also need more than one session. One is not going to be enough, depending in each case. If it's for wellness or anything like that, once a year, stuff like that, that's fine. But if you have other underlying conditions or we want to treat a specific problem area, we need more than one. That's something to keep in mind. And yes, I would think this is going to help you a lot, especially just so that we can help with inflammation and maybe recover some of that function and breathing a lot better as well. I see so the screening is down there. That depends. If you already have a screening and you can send it to us beforehand, you can. If not, we do it here in Mexico. Yes. How many sessions is the average? That's going to depend on each patient. I would say at least 3 to 4, depending on each condition. And Each session is about an hour up to 2 hours. They're really fast, and it, it's easy to apply in a way. So it's a short process. Um, have the sessions, that's going to depend a lot on how long you can stay in Mexico, or if and when, how many times you can come for treatment. So some of them we can do it in a 1 week or 2 week period where we can apply all of the sessions in that timing. But if you can't be for so long in Tijuana, we can do it every month, every 2 months, every 3 months. So that's going to depend on what kind of treatment that we're doing and what we're working with. Like if we did a lumbar puncture, we can't do that often. So that's going to be every 3 to 4 months. Okay. Finances, we talk about that.
Yeah.
How do we
Are you reading
how
the
do we
chat?
verify?
Are you
I'm
reading the
reading
chat or the
the
Q&A?
I'm reading the chat right
Okay, okay,
now.
okay, okay.
Yes. Uh-huh. Okay. So how do we verify the quality of stem cells? The lab is going to provide a certificate of quality and efficiency of viability as well. So it tells you the percentage of viability of these cells. So we show you that. Yeah. Does
I
your
did
stem cell
mention
therapy help with
that
stroke?
we have one of the highest quality stem cells available because
Yes.
this is not something that got started yesterday. They've been working on this for years. Um, and I visited this lab about, I don't know, in 2010, and they've been researching, they've been modifying, we have scientists, we have doctors like Dr. Raquel that they do know what they're doing. So we have the best quality stem cell, and we can do a good job diagnosing what you need and how you need it, at what uh, concentration you need it. Go
Mhm.
ahead. Yeah.
The next question is, does your stem cell therapy help with stroke recovery? It can help with that, yes. Um, Especially to recover some of that cognitive function and to reduce inflammation in the brain so that you can recover a lot faster. How much you're going to recover, that's going to depend on each patient. Okay. Okay. If the patient has active stage 4 breast cancer, is there anything we can do for that type of patient? She's in her late 30s. Okay. Hmm. When we talk about cancer treatment, this is going to be very complex. And it's really important to get all the scans, everything, the most studies possible that she has from the cancer that she has, if it's active, if she's in chemotherapy, what are we working with at the moment? So it's going to take a couple of consultations. She needs to be seen by an oncologist here in Tijuana, and we need to see how her general health is, because that's going to depend a lot on what type of treatment or the amount of cells
Yeah. Yeah.
that we're going to be using.
But like Dr. Raquel mentioned, patients with stage 4 can prolong their life, but it's very hard to reverse. I mentioned, like, my mother had lung cancer stage 4 as well. And actually, the name of the Hospital Azar, is a tribute to her. But like she mentioned, stage 4 is basically, the idea is to prolong their life.
Mhm. Is there any side effects or possible other medical conditions to occur? It's very low. Usually, if there's any, maybe low blood pressure. That's why we have to do it. That's why we do it in a hospital. We check your vital signs during the procedure and everything. But Side effects, they're very low, maybe a headache, and other than that, no, to be quite honest. Okay. For chronic fatigue syndrome, we can use that as well. We can use it for that. I would say on average at least 3 sessions. But that, like I said, every patient is different, so the treatment is going to be very personalized, and that's going to depend on how you feel as well. Um, does stem cell therapy help with hearing loss? Hmm, depends on the cause of the hearing loss. So that's something to este So it's going to depend a lot on each patient. So if the hearing loss is more of a brain issue, then maybe we can help with that. But if it's a hearing loss because you don't have a certain part of your ear or the middle part of your ear or something like that, that's probably not going to help that much. Okay. Okay, with keloids, yeah. Has stem cell work for patients with ulcerative colitis or Crohn's disease? Yes, we can use it a lot for Crohn's disease, for basically to reduce the inflammation, and that would be IV treatment. And we do need a couple of sessions for that, but it can help. Um, it's not going to take it away, but it can help. Yes. MS patients. Okay, so with MS patients, it basically helps with that inflammation and to help reduce flare-ups because with multiple sclerosis, the issue is that sometimes you're okay and then all of a sudden you can't move. So that's going to help with your brain inflammation and to help signalize your brain a lot better to the to extend to the rest of your body so that it can like move a lot better. Mhm. Okay, how can we have a meeting of potentially working together on getting new patient news? That's not with me.
Rosie, you
Um,
can reach out to us and talk about sending patients. You can send an email to phil@sources.com. So it's PHIL at SOURCIS.com. And we can discuss it or call 855-768-7247.
okay, what about MS? Okay, like I said, it's not that it's going to repair the million sheets or anything like that. It can help basically with the progression of the illness and like mediate inflammation and immunomodulate so that it doesn't create more flare-ups, like I said, and just prolong life and to prevent more episodes. With eczema, with children, it's a little bit difficult right now. It's not very. It's not. It's only right now. It's only approved for certain type of pediatric patients like autism and ADHD and stuff like that. But when it comes to kids, right now, I do not treat children unless they're 12 and up. Yeah, for legal reasons. So yeah. With dementia, yes, it can help with dementia, just mainly with reducing inflammation, like I said, and it with exosomes may help a lot more with dementia to hopefully and help with this patient to recover some of the memory or just stop the memory loss because usually if you already lost something, we can't really recover it that much, but we can help for it not to happen so fast. Yeah. Do you have previous patients with similar issues that can share experiences with someone on the fence? Yeah, we do.
Okay, so let's jump on the Q&A because
Yes.
So again, Tammy, we're gonna post this on
That's what
YouTube.
was
We
posted.
will send you a link. Just ask Heather to send you the link. So so Cindy is well, that you already asked, you already answered ulcerative colitis. Stroke patients you answered.
Mhm. Yes.
Um, so for hair loss, um, so I don't
Yes.
think
Okay. Talk about successes. Rejuvenate her hair loss. My husband is hoping to get it done while I'm getting bariatric. Okay, great. Yes, with hair loss, it's really important to see. I need to see how much hair or how much hair thinning we have. Um, but it does help with promoting hair regrowth. It's not fast. It happens with time because hair regrowth has a cycle and it can take up to 2 to 3 months to see results. So that's why we need multiple sessions for those kind of patients for hair loss. At least every month, once a month, we would need treatments, and you would see results within 2 to 3 months.
I
Mhm.
have I have a
For
request.
ADHD, yes,
If you
yes.
guys can please put your questions not in the webinar chat, just put it on the Q&A tab because we can only see it in one place and we can answer it different ways. So so please put your question on the Q&A tab and not the chat tab. Okay, go ahead.
Mhm. Okay. For ADHD and autism, you need medical documents to help recommend the stem cell type. Yes. For any type of disease or illness that we want to treat, medical documentation would be very helpful just to see the stage that we are in. And that way, once we start treatment, we can get tested again and see progress. So that's going to be very important because, like I said, it's not something that's going to happen one day to the next. If you see progress, it's going to happen within 2 to 3 months because that's the time that it takes for the stem cells to um, help our patients and the viability and all that kind of stuff. With patients with autism and ADHD, we usually use IV treatments, first of all, and then instead we use also exosomes via nebulization because, like I said, it passes through the encephalus part of our brain. So it's going to help. And a lot of kids or patients with autism who are nonverbal with these type of treatments tend to be verbal a couple of months later. So it's impressive how we can help our patients with that. Later on, there's also a possibility of using intrathecal treatment. That means through the spine. So that's why we need multiple sessions. My son is interested in stem cell for what he calls hair loss. Okay. So yeah, like I said, with for hair loss, it's with microneedling, and we would apply it directly to the scalp. And I do recommend at least once a month. Um, and I also have a 20-year-old daughter who might benefit to having had meniscus surgery, and she always complained of pain in that knee. Yeah, we can help with that. If she has an X-ray or MRI, that would be very helpful to just see where the damage is, and we can apply it directly to the knee. Yes. What about type 1 diabetes? How does this work to repair the pancreatic cells? It's not that it repairs the pancreatic cells, but it helps with inflammation and it can help to keep whatever whatever pancreatic cells that you still have, they're going to help them um, stay in your pancreas. So it's going because like type 1 diabetes is an autoimmune disease as well. So the beta cells get destroyed. So if the patient is young, that's the best time to do treatment for type 1 diabetes. So whatever beta cells that you still have, we can protect them with stem cells so they can stay there, and that way you might not need that much insulin, and also with your diet and everything.
Okay. Well, it looks like we answered almost all the questions. There's no more. Um, well, thank you so much, Dr. Raquel, for taking time
Thank you.
and being with us today. I appreciate your expertise and your contributions. And everyone that joined, thank you so much. We probably would have another webinar soon. We will have the first um, of the every first Saturday of the month we do for NBC, which is bariatrics, and hopefully we will do more of these. Thank you so much. Have a good day. Bye bye.
Thank you, everybody. Have a great day. Hope to see you soon. Bye bye.